Hello. As you can see that this is a model of your jaw that represents your teeth, your gums, and the bone. Many people ask that what's the difference between a crown and an implant. So today I'll be explaining that. This is what your teeth look like from the outside, and sometimes the patient has a missing teeth or a gap in between two teeth. So in that case we put implants, and this is how an implant is worked. In this hole we drill it and we put an implant. This is what an implant looks like. It's just an example. It goes like this inside your bone. To fill that gap, we have two options. The first one, as I told you, an implant option. In this case, we have individual teeth for every teeth, individual crown, and like this, it will be placed on the first one. This is on the second one, and this as you can see is an implant. You need 2 visits for this procedure to be completed, as we cannot put a crown on it instantly. You need 2 to 3 months for the time to heal, and it gets integrated inside your bone. And after that, once you crown on top of your implant after 2 to 3 months, when it heals like this, and this way your whole smile is complete. As you can see, 3 individual crowns. The second option we have, sometimes the patient wants to complete the treatment in just 1 visit. He doesn't want to come back. So in that case, we have an option of a crown bridge. Now I'll be explaining what a crown bridge is. For instance, we'll remove this implant. These 2 teeth. So what basically is a crown bridge is it can consider as a 4 teeth bridge or a 3 teeth bridge. You have 2 of your own original teeth and there is a gap in between. You don't want an implant, you don't want to come back second time. So what we'll do is take this bridge. This is a crown bridge that's placed over 2 of your original teeth, and it closes the gap like this. As you can see, there is no implant inside, but this will be attached to your gums like this, and it will also give you a perfect smile, and all 3 of them are crowns. As you can see in this model, there is a gap in between the bridge and in the place where we've put the bridge, but in reality when we do the procedure there is no gap. Your gums will cover this bridge, and if you eat something or drink something, it wouldn't get stuck inside your teeth, provided that you use water floss, clean your teeth regularly, take care of your oral hygiene and everything. If you do that, that your teeth or crowns can last up to 20 to 30 years. It's not a problem. Alright, this is for today. If you have any other questions or queries, you can contact me on WhatsApp or send us an email.